Let's talk about Medicare Part B as the ultimate lead generation tool that nobody is talking about. So if you guys don't know me, my name's Tony Maritato. I'm a private practice owner and a practicing physical therapist. I treat patients because I love treating patients. I don't treat patients to make money, but I run a physical therapy clinic to make money. So what do I mean when I say Medicare is the ultimate lead generation? I'm going to compare two scenarios. Let's take a typical cash-based private practice. This is usually a high-caliber therapist, somebody who's worked for decades to hone their craft, to become amazing at what they do, and they've gotten so good at what they do that they can't afford to accept Medicare reimbursement. So what they do is they say, I'm going to step out of the Medicare system. I'm going to go cash-based only. Of course, you know, and I'll talk about this on another video in greater detail, if you are delivering covered services to a Medicare beneficiary, you are obligated by federal law to submit a claim for those services. But that being said, the better you become as a physical therapist, the higher compensation you should receive. So the only way to raise your compensation above third-party reimbursement is to go on a self-pay, cash-pay basis. But for those individuals that want to find the perfect scenario, that want to remain accessible to Medicare beneficiaries, that want to provide Medicare beneficiaries with the service that Medicare is buying, but then also offer those same people the added value of having something above and beyond what Medicare pays for. We understand Medicare doesn't pay for everything. In fact, if you look at the top of the advanced beneficiary notice, there's a specific sentence that says, even if you or your healthcare provider believe that you would benefit from these services, we believe Medicare will not pay. There are things, if Medicare covered everything you needed, they would cover better food, better sleep, better lifestyle management, mindfulness, all of these other things that they do not pay for. So as a therapist who wants to deliver the absolute highest level of care while still providing access to Medicare beneficiaries, this is the perfect scenario. You decide to contract with Medicare. You develop your program, whatever the program is. For me, in my space, I focus on treating patients after a total knee replacement. I believe that there's a lot involved in the recovery process beyond what is considered a medically necessary covered service under the Medicare Benefit Policy Manual. So what I do is I would develop my post-surgical care program. I would determine what is covered under the guideline, what is not covered. As an example, food. Food is not a covered benefit. Cooking, preparing, doing things around food, using food as an element of recovery, none of that is covered by Medicare when delivered by a physical therapist. So what I would do is create a program, a rehab program that might be $3,000, $5,000, $10,000. A portion of that rehab program will fall under the Medicare coverage guidelines, but the rest of it will not. And so if I am contracted with Medicare as a contracted provider, preferably participating provider, I can bring Medicare beneficiaries into my ecosystem. I can allow physicians, surgeons to refer those Medicare beneficiaries to me. And if that Medicare beneficiary, after the evaluation, determines that person doesn't want the value-added services that I believe would benefit them, I don't have to treat them. But I can still provide them the value of the initial evaluation, give them all the educational information, provide them with resources that I would refer them to therapists that I know at the local hospital or even across the street from my clinic. There's a NovaCare. In a heartbeat, I would refer patients to the NovaCare across the street. Those therapists will only deliver what Medicare will pay for, and they'll do it to the best of their ability. But for me, for my business, for what I believe is ethically, responsibly, morally, what I should be doing for my patients, I can not only provide the services that Medicare will pay, but Medicare opens the door to allow those patients at least the opportunity to come, see what I have to offer, get my initial evaluation, get the initial education and information that I shared during the evaluation, and any of the free resources that I provide to anyone that wants them, that needs them, that would benefit from them. Medicare is the ultimate lead generation, because if I'm running paid ads and I'm spending $2,000, $3,000 a month, I might as well just accept $2,000 or $3,000 a month less in compensation to complete those initial evaluations. And then a portion of them are going to sign up for a full hybrid plan of care that includes self-pay services at the level that I believe my patients would benefit from. So if you want, think about that, consider rolling that out, ask me any questions that maybe I didn't cover that you're not sure about, and I'll catch you on the next video.